everyone, this is your favorite high achievement sister Zawadi, and welcome back to my channel. If you're new, you're in the right space, but I want to say thank you so much for tuning in. This channel really is about lifestyle, workout, business, and of course travel. Recently I have focused my attention on business because Liberia is so dear to my heart, and also I continue to do business in Africa, mainly Liberia. This is why business is the main focus at this point in time. So if you're new, welcome. Continue to comment, to share, and to, of course, if you're very new, you can subscribe to the channel. Okay, thank you so much for tuning in. Today really it's about what is currently happening in Liberia, the crisis that we're heading into, and how some of us can reduce that urgency of the crisis taking place. So that's what we are going to talk about here on this channel today, or specifically me, that's what I'm going to talk about. But before I go into this, I have received calls from relatives back in Liberia, in the United States, some of my friends in Europe, talking about the coronavirus crisis in Liberia and how we can all play a key role in reducing the problem that is currently taking place. You're wondering, who are you, Emma? Why do we have to listen to what you have to say? That's fine. That's a very valid question, but the crisis going on is not something that we all need to play with. So before I go on and proceed, I will lay my credential out to all of you so you have an idea of what I know and what I have been doing, which is very pivotal to this video. I have my undergraduate degree, which is my bachelor's degree in science, and then I also have my master's degree in healthcare management. What that does is I am able to manage healthcare entities, from clinic to healthcare centers to hospitals to facilities. That is exactly my area of expertise as far as that is concerned. I know you guys see I do other businesses, but currently that's what I do, although I am in a training program. But how I've recently been managing this facility shows that yes, I am able to lead and guide people, about 500 plus employees at this time. So that's my brief background. I have volunteered with COVID patients. I have volunteered with employees who had directly faced COVID, and I've also written policies within my own place of work regarding COVID and how we can all reduce the exposure rate as it relates to COVID. So I do have some experience. I would say very, it's not a limited experience. I have vast experience to speak on the COVID crisis that is taking place and how we can all help. So now that you've heard everything that I've said about my credentials, let's go on to talk about what we can do in Liberia to help reduce the problem. Okay, so politics aside, the first thing we really have to do is to close all entry points. Very important. I know people who are in Liberia right now are there for business. Maybe if you're from Guinea, you're worried that okay, those people are here to do business and they help our economy. If you're from Lebanon, if you're from India, which is like a high red zone, if you're from there, the concern is, you know, how are these people going to contribute to our economy if we are closing the borders to them? Well, the safety of our people comes first. That's the key. So we have to close the entry points, the airport. You have to limit travel into Liberia, especially from those red zones that I've listed. You have to close the border where cars are able to come through. You have to close that. And if you say you don't want to close those places, then you have to put policies in place as far as isolation. When you enter into Liberia, are you to quarantine for 14 days? That's very important. And if you are if you are quarantined for 14 days, are we doing contact tracing, which is if somebody is exposed, they have to inform the health ministry that they have been exposed, in essence leading them to isolate themselves from people who may be exposed to them, in that spreading the virus to other people. So we have to do contact tracing. Is very important to how we can mitigate this problem. So like I said, entry points has to be closed and people has to be quarantined, and then they have to be followed up on as far as the exposure is concerned. Very important. So then we want to talk about social distancing. there is science behind this. I know some people don't believe this, but it is. If you come in close contact with people who, display those symptoms, and you are very close, you are likely to get caught. You're likely to catch the exposure. So you want to make sure you do your 6 feet away from another person, and that will actually help you. Please, very important, wear your mask. I know when I went to Liberia recently, people were laughing, but you girl, you think I want you to wear mask in this country yet? Yeah, people finding not have masks in this country. That's fine. You don't have to wear mask. At the time when I wore my mask when I was there, you could make fun of me, but right now this is not time to be funny. And the thing is, you are not only looking after yourself, you're looking after your brother and sister who may be sitting next to you. And if you have the virus, you could actually expose other people to it. So please wear the mask as best as you can at all times. This helps to alleviate the problem. That's that. The third thing is to constantly wash your hands. I know before COVID, this is a problem that our people struggle with. Some of them go to the restroom, it's hard for them to wash their hands, and it's not sanitary, it's not healthy. Please, as you all know now, it's very crucial. We have to keep our hygiene level up. So we have to wash our hands. Very, very important. So these are some of the things that you can do. Now let's talk about crowds. I know many of you guys like Pledge. I like Pledge too. But in order for us to reduce this COVID problem, we must avoid crowded places. The Pledge can wait. If you know the beach is very crowded with people on a Sunday, please go somewhere else. And if you're at the beach, separate yourself from people. You don't have to be in crowd talking. I know you're like when people, when you go to football games or when you go to the beach, you can start arguing for something that happened 20, 40 years ago with people, and you're just sitting crowd and you just start talking, and then it starts to spread. So at this time, please limit crowds. If you want to go to crowd, wear your mask, wash your hands, do your social distancing, and it's okay. But if you don't do any of those and just go talk football, go to the beach and argue about what kind of celebrity have the money or what kind of football player make all this money, that's okay. But you have to be aware that you can do social distancing, which is very, very important. So reduce crowds. Many of you who get in the same car with 5, 6 people in the same car, in the same back seat. I know we don't have many cars in the country, or perhaps maybe you have very low funds. I'm encouraging you to wear your mask. I know if you want to sit on the other person's lap, encourage that brother and sister. Easily, my sister will all come and sit in the car, or my brother will all come and sit in the car. It's still possible for you to please wear your mask. Let's encourage each other to do so. But if you decide because he or she is not wearing their mask, you're not going to wear your mask, that's going to cause a huge issue. So let us do the best we can if we go into those crowded areas. And I'm going to plead with people who are in churches. I know you want to carry on your service. Having a church is a business, and rightfully so. But you have to encourage your members to sit 6 feet apart. Encourage your members to wear masks. Have water outside, hot water that people can wash their hand upon entering your church. Very, very important. And for clubs, if you people are going to club, Liberian people love Pledge. If you people are going to club, you club people, I understand. You please have something there for people to clean their hands before they enter, and allow people to wear their masks. This thing is very standard procedure. But if you go to a club and it is not there, and you think going among other people, it's okay, you have to think about the safety of others that you may come in contact with, even your kids, your family, people you don't know, you may come in contact with them. So please limit that. The other place is the market. We all have to eat, right? You have to go to the market down Waterside there. You have to go to the rail there to go buy your food. Absolutely, very, very important. But the sea market people, I'm going to also encourage them to allow for social distancing. that you can even have a sign that said, stand right here away from your friend, mask is required. I know we're all struggling to survive, but at the same time, your health is very key. If you don't have health, that market will break down. If you don't have good health, that food you go buy, you will not even eat it before you pass out. So we have to protect ourselves. Very, very important. Okay, like many people, I'm tired receiving death news. I'm tired. So I trust that all of you can follow guidelines, and even if the government have not put out many of the policies needed, you can still do your individual part to take care of yourself, your loved one, your family, and people you don't know. Lastly, hospitals, you are the entryway for people to say they are coming for good health. If you don't put standard procedure in place, the people that you are treating are not going to be in good health. So hospital, please start from the entry point. Make sure people are getting tested for fever. If the temperature is over, and you want to make sure, ask them questions as it relates to exposure. Have they been in contact with somebody within the last 24 hours? Have they been traveled certain high zone areas? You have to ask them before they even enter a hospital. And most importantly, workers in hospital have to set example. You can't tell somebody sit 6 feet apart and then you're hugging your coworker, you are sitting in front of your coworker's nose. Many of you people in our country have to set examples for people going into the hospital, because again, these people are going there to seek health care. You can't be on the desk talking to another person over there. No, that's not right. You have to adhere to what you're telling people to do. Healthcare workers, please wear your mask, okay? If a patient go to your facility for treatment and you know that person has been exposed to COVID, it is very important that you isolate that COVID patient from everyone else, so that way it helps to alleviate the problem that could spread beyond. And after that isolation has been done, then you can allow people to go see that person. But if the person has been exposed and you decide, visitor is going to come in here, that visitor too may get exposed, and everyone starts to get exposed, and this thing will spread. So make sure you isolate patients away from other people. Be example in hospital settings. Very, very key. And you people also know this is rainy season in Liberia. When does this virus become more active? Go figure. Well, I'm letting you know when it's cold, right? That's perception. Liberia problem has just recently been an influx. So when people, I have said a lot, I'm really just encouraging you, let us do our part. Let us reduce the numbers, okay? Let us keep our country at peace, because if people continue to die in that country, it's just not going to be very peaceful. Because peace does not even only equal war zone. It does not. Your mind needs to be at peace. You need to know your brothers and sisters, your family members, everybody is safe. And by you doing the best you can every day, it will save life, okay? So let us do our best. If you have any questions, any question that you may have as it relates to what I'm telling you, always write the comment below and I respond as best as I can. Some of the policies and procedures that I put in place at work is very, very simple actually. And these are things that healthcare facilities can actually practice. If John does his best, Mary does her best, everyone else will see and say, okay, yeah, everybody's doing the best they can, and we can all just be fine. Before I go, I would like to say hello to your neighbors, your friends, your family. Call somebody this week and say, hey, how are you doing today? Somebody you haven't talked to for years, say, hey, I love you, or whatever it is, because life is too short. I'm gonna keep saying it. Life is so short, especially in these critical times. You could be gone tomorrow and not say something to somebody who you've been wanting to say it to. You have nothing to lose if you tell someone you love them, okay? So take care, be safe, be blessed, and just stay away from COVID, crowded Zooms, okay?